Hello, applicants and prospective applicants to the UVM Neuromuscular Medicine Fellowship. Thanks for taking the time to learn some more about our program today. I'm excited to teach you a little bit about the opportunities for you here in Vermont. University of Vermont program runs in beautiful Burlington, Vermont, which sits on the um, border of Lake Champlain and the Green Mountains. It's a really quaint place to live and practice in a small city. And we have many colleges and universities right within Burlington itself. So there's a lot of academic activity going on any one day. But it's really a very nice place to live, work, and practice medicine. There's a lot going on in Burlington. We have a bustling downtown where we have an outdoor mall called Church Street Marketplace, where there's many shops and restaurants to visit both in winter seasons and in summer seasons. We also have very active farmers markets. We have a really nice theater downtown, which brings in some nice national acts. We have minor league baseball and soccer teams. We have a lot of lakefront activity given proximity to Lake Champlain. And obviously, we live in Vermont, so there's lots of winter activities as well, like skiing, downhill, and cross country, and other winter activities. It's really a nice place to do some things when you're not at the hospital working. To give you a frame of reference, Burlington is under the red dot there, right on the border of Lake Champlain, which makes the border between Vermont and upstate New York. Within that orange region is our catchment area, which includes a large swath of the state of Vermont, and as far west in New York as Syracuse, and as far south in New York as Albany, New York. So a very big catchment area, which catches about 1.5 million people who are sending neuromuscular patients to our center to be seen. If you want to get outside Burlington and get to a city, Montreal is our closest big city, which is about 90 minutes away by car. If you want to go a little bit farther afield, you can get to Quebec City within about 4 hours, and to Boston in about 3.5 hours. And we have multiple direct flights out of our small and very accessible airport in Burlington. The hospital itself is this nice white building here, which is attached both above ground and underground to the medical school. And it sits sort of up the hill from the lake. From many of the hospital rooms, there's really nice views of Lake Champlain and the mountains in New York. We're a 400-bed academic medical center. We have all the bells and whistles of a tertiary care center. We have a level 1 trauma center. We have about 1 million to 1.5 million clinical encounters per year, many residents, many fellows, so lots of other trainees for you to interact with on a day-to-day basis. The College of Medicine is recognized as a leader in primary care and increasingly becoming a leader in research. We have a nice clinical translational research program, which includes sites in Vermont and Maine for driving multi-center research. And we've been awarded for being one of the more diverse medical schools in the United States. The Department of Neurological Sciences at UVM is a unique department. We have a joint department between clinical neurology and basic neuroscience here, which encompasses about 60 to 70 faculty members. We have 20 neurology residents, 5 fellows. We have all the centers of excellence across all aspects of neurology. But one of the things that's really nice about being in a joint department like this is that there's interaction between clinicians and more basic scientists, which increases the level on which you discuss your patients, but also increases the ability to do translational projects and partner with people across the campus. And it's a really nice and unique setup. And we have many sessions throughout the year that are joint sessions among both wings of the department. This is a picture from our education retreat this past year. Our neuromuscular division is one of the bigger divisions here at UVM within our department. We have six neuromuscular neurologists. We have a neuropathologist who's part of our faculty for the program. We have one neuromuscular fellow and typically one clinical neurophysiology fellow each year. And then we have multiple people who are working with the division. So we have a fellowship administrator. We have 2.5 nurses who support the clinicians in reaching out to patients and trying to manage the day-to-day for our many patients. We have two research administrators and possibly three within the next year. And we have 3 or 4 EMG technologists at any one time. We have centers of excellence across all aspects of neuromuscular medicine. This is some shots from our EMG lab. We run Natus EMG machines. Currently, we have 3 machines and are likely switching to 4 machines within the next number of months to increase our capacity. We have a fully outfitted autonomic lab as well in our area where we have a tilt machine, sweat testing, and a host of other tests. We do between 2,000 and 2,500 EMGs per year. We do about 50 autonomic tests per year. The fellow has a dedicated office in our neuromuscular clinic, but they also have a dedicated office space up in the EMG lab. And this is a view here at the bottom from that office, which looks out over the lake and the mountains across the lake. One of the best parts, I think, about our program is our faculty and the faculty's commitment to teaching. We're a program that really values education, and all of our faculty members in one shape or form have been recognized for teaching both here in Vermont, but also at other centers that we've come from. One of the other nice things about our faculty is that many of us trained in different places. So we all have things that are common and things that are unique to our approach to neuromuscular medicine. So we get to teach our fellow a diversity of different approaches to the things that we see. Dr. Wahid is an expert in inflammatory neuropathies and is a master clinician and teacher. He also directs the MDA program. Dr. Isaacoff is a trained bioethicist and also is the associate director of the residency program. She's also the assistant director of the MDA program and has interest in muscular dystrophy research. Dr. Tandon is a longtime professor here at UVM and is a world's expert in ALS. And runs many different clinical trials through our clinic and is currently the director of our clinic. Dr. Kolb is, in addition to being a neuromuscular neurologist, is the director of the neurology clerkship and an expert in chemotherapy-induced peripheral neuropathies and research related to chemotherapy neuropathies. Dr. DeWitt is a neuropathologist, and he has interest in both central and peripheral nervous system research and is really an amazing resource for our fellow. Spends time each week reading muscle and nerve pathology with the fellow. Dr. Eckenstein is our newest faculty member who just joined this year. She is a former UVM student who has come back after completing training at the University of Utah. She is an expert in ALS among all the other aspects of neuromuscular medicine and has a research program that's getting off the ground in ALS. So we cover a diverse number of things. And of course, my name is Mike Hare. I'm the program director here. I study myasthenia gravis as well as side effect and disease-specific outcome measure development. So we cover all aspects of neuromuscular medicine here at UVM, but we really value the time that we get to spend with our fellows, working through cases and talking about and learning about neuromuscular medicine together. The fellowship has multiple experiences. We have a neuromuscular clinic where the fellow actually maintains their own clinical schedule and has their own panel of patients that they follow throughout the year, which gives you the opportunity to manage patients in between appointments and learn how that works in neuromuscular. You also spend time each week in our multidisciplinary clinics, which run through our rehab hospital, where you get to participate in multidisciplinary care and learn from the many other folks that see patients in those clinics, including physical therapists, occupational therapists, respiratory therapists, et cetera. You spend a fair bit of time in the EMG lab learning EMG, both basic and advanced techniques. We do some ultrasound. And as I said earlier, we have full autonomic testing available. The fellow reads pathology a half day per week. And then we have a consultation service where we provide consults during business hours only to the inpatient neurology program. And the fellow gets a chance to see some of those patients and then provide some guidance to the floor teams on how to best manage the neuromuscular patients. And it gives the fellow an opportunity to teach the neurology and other subspecialty residents that are rotating in the hospital. There is no call as part of this fellowship. Your weekends and evenings are your own. We also have an extensive education program set up for our fellows, which includes a full neuromuscular teaching session where we cover all the breadth of neuromuscular medicine through a combination of lectures that are shared between the fellows and the neurology residents, as well as fellow-only neuromuscular sessions, which happen a couple of times per month over coffee. We have a dedicated EMG didactic series, which is front-loaded, where we do an extensive EMG training in the first month that the fellow arrives here in Vermont, and then we space it out and talk about more advanced things over the course of the year. We also have a monthly neuromuscular pathology conference where we show muscle and nerve to our faculty, residents, and the fellow, and you get a chance as the fellow to teach in that conference. Our fellows and alumni are great people. Our current fellow is Dr. Lauren Herrera, who joined us from the University of Cincinnati and is a neurologist. It's a picture of her presenting at the Neuromuscular Study Group in 2024. And these are some of our recent alumni. We've trained a number of physical medicine and rehab trained physicians, as well as neurology trained physicians. Our fellows typically go into some combination of either employed or private practice or academics once they get done with the fellowship. One of the nice things about the alumni of our program is that they all stay in touch both with us as well as with each other over time, which is a nice aspect of our UVM program. There are ample opportunities for fellows to participate in research here. If you are interested in doing research, we will provide you with protected time to do it. And we have travel funds available on our website. And here listed are some of the academic publications and presentations that we've done recently. And on the right, there's a picture on the top of one of our former fellows, Dr. Brendan McNeish, who's presenting at the AANEM meeting with Dr. Kolb on chemotherapy neuropathies. And then in the bottom, that's Dr. Herrera, our current neuromuscular fellow, presenting at the Neuromuscular Study Group, and one of our neurology residents, Muhammad, who is also presenting at the Neuromuscular Study Group this year. So we try and have our fellows doing things that are academic and also getting a chance to present at meetings where they can network and meet other people in the field. And along those lines, we send our fellow to at least one conference, if not two, every year. Dr. Herrera this year attended both the Neuromuscular Study Group as well as the AANEM conference. And one of the nice things about going to conferences is that our fellows tend to come to the conferences as well, which gives us an opportunity to get together, build the UVM community. We always have a UVM dinner at these sessions and have a chance to get together. And this is one of the ways that our fellows get to know each other. So I hope you enjoyed learning a little bit about our program on the video today. We look forward to learning more about you. Please feel free to reach out at any time with questions, and we look forward to meeting you through interviews this year. Good luck.